So good afternoon, everyone. I'm Gigi Moreno. I'm a senior economist at SCAG. And as I said earlier, I hope you all enjoyed the interesting discussion about the impacts of COVID on how we work, where we live, how we live. And so I'd like to welcome you to this roundtable, which is a discussion of the fiscal impacts of COVID-19 on California's local governments. And today, Siva Rodnansky and Andre Commandant will lead our discussion. And Siva is an assistant professor of urban and environmental policy at Occidental College. And his research focuses on urban policy related to housing, transportation, residential mobility, and neighborhood change. And Andre is a postdoctoral scholar in the Department of Urban Planning and Spatial Analysis at USC. And his research focuses on urban structure, segregation, migration, and residential mobility. And so I'll turn it over to Siva, and then Andre will present after. Is that the correct order? Got it? Very good. So you guys can go ahead and share your screen. And so they'll present for about 20-30 minutes, and then we'll have some time to discuss. And you guys can post questions on the chat.
Perfect. Thank you, Gigi. Nice to meet everybody virtually. It's really good to be here at SCAG and USC's workshop. As Dowell, I think, mentioned at the end of the general presentation, I went to USC for my price for my doctorate, and Andre is there now, so it's always nice to be back. Hopefully you can see my screen and you can hear me. If not, please let me know. So today we're really happy to welcome you to this last bit of the work of the two-day workshop on the post-pandemic city. And whereas a lot of the previous today's really spoke about, you know, the household, the person, the region, the demographics, housing, we're going to talk about fiscal impacts and finances. And I think for this broad and diverse group, it's a very interesting topic, and we're gonna dive into the details a little bit, and then we're going to talk about general trends as well, and specifically going to talk about the past year and the fiscal impact of COVID-19 on California's local governments. As Gigi said, I'm pleased to be joined by Andre Commandant, also at USC Price, and this is joint work with Marlon Bornett and kind of a larger team at USC, Occidental, and UC Davis. And we'd like to gratefully acknowledge funding for it from the Chan Zuckerberg Initiative and the Haynes Foundation locally. And for those of you interested in hearing more about this survey or that we'll be presenting or the general project, please reach out or go on our website. There's links posted here. So, you know, this is the fifth or sixth session in a session about the pandemic. So I'm not going to belabor the point, but, you know, statewide, I think we're all in agreement that COVID has battered us in a variety of ways and has changed the way that, you know, things have been functioning, at least in the short term temporarily this year, right? 3.5 million cases statewide, 62,000 deaths, 67.5 million tests, COVID tests administered, for almost 40 million vaccines administered, right? And a slew of economic impacts over a year of stay-at-home orders, you know, which seem to be ending today. You know, unemployment, ups and downs, changes in consumption and production and shopping, retail, walking around, you know, the neighborhood, working from home, and illumination.
Siva, your sound, we lost your sound there. So
there you go. Now you got it.
oh, there you go. Okay.
It was muted. Yeah.
All right.
It's only gone for about 15 seconds before Gigi.
Hopefully it's back.
Yeah, good.
Good. Thank you. Sorry about that. All I was saying is we're going to tell you how all these things have, or we're going to try to tell you how all these things have affected local governments fiscally in California. Specifically, we're going to report on 2 surveys we've done in a wave of surveys of municipal, county, and school district budget officers, which covered 4 key areas that we're going to talk about today. Impacts on revenues and service levels, impacts on budgets, how localities have coped, and then specifically how they've used reserves and transfers to try to get them out of this kind of fiscal pickle. For those of you who can't stay for the whole hour, wanted to very briefly touch on the key findings. So first, we did 2 surveys, one in the fall of 2020, so about 6 months after the pandemic started here in California, and one more recently in end of spring in 2021, so about 6 months apart or a year after. And what we found was that there was a large degree of uncertainty and pessimism about budget balancing and revenue impacts in the fall wave, but that has abated, though has not gone away in the spring wave. There's been heightened demand for services, and that's persisted throughout the whole year. And we'll talk specifically about what type of services. And then we'll dive deeper into the strategies that local governments use, but the broad suite of things that both cities, counties, and school districts have used have been deferring projects and maintenance, reducing and restructuring services, cutting or furloughing staff, and using reserve funds. Now, these are obviously very diverse strategies, so we'll talk about them in turn. I know there are some technical people on this call. I know some of you and some of you have heard of, so I'm going to show one survey statistics slide just to better explain what we did and kind of to make sure that everybody's on the same page, and we can come back to this if anybody wants to talk about it. So as I said, we did 2 rounds of surveys. They covered school district, city, and county budget officers. It was a full population sample. So basically every person in a particular region who occupies this type of position was emailed, and then we got responses. In the first wave, it was more of a pilot survey where we focused on Northern California and the Central Valley. And then in the spring, the most recent wave 2 survey, this was the whole state. Overall, our response rates were relatively steady, about 11 to 12% on a sample of 870 in the first wave and about 1,500 in the second wave. Relative to other email-based surveys of kind of experts like this is known to be pretty good. So we're not bragging, but we're happy that we got robust responses. And not only that, but we're continuing the waves of this survey, because as we know, fiscal impacts don't just come out, on the day of or on the day that the budget is finalized, right? They continue over years as things play out. So we're going to continue these surveys every 6 months. And thank you to any of you who may have encouraged your colleagues to fill these out or have fielded emails from us. So all in all, we get about 100 participating agencies in the first wave and 172 in the second wave. And the questions were voluntary. So you will see that there is some bouncing around in terms of how many people answered each particular question. Finally, this is the second wave survey is closing currently. So we are, we're still cleaning up the end of the results, but overall, we're showing you kind of the best and freshest of what we have. So let's talk about revenue and service levels. First, we had respondents compare kind of what they saw today in COVID versus what they saw in the Great Recession. Not because we were testing their historical knowledge, but because that was the most recent, very large fiscal impact that we thought would be a nice comparison. So this page shows how revenue declined relative to their experience in the Great Recession, which we said around 2008 recession peak. If you look at the left-hand side pie charts, overall, about a third of respondents said that revenues declined faster than the Great Recession, and about a third said slower. And this has continued to be the case, though fewer and fewer respondents have said it is faster. So over time, people thought this was about as bad as the recession. However, it's gotten better as the year went on. And when we asked them specifically about service fees, because we thought that a lot of the stay-at-home orders and economy closures would specifically affect particular services people might be going on, the patterns have been the same. So revenue declines have been steep and somewhat comparable, at least according to these individuals and these government entities to the Great Recession. And we see very similar proportions for SCAG. Now, what about services? How have services increased? Revenues have declined, but doesn't mean that you can just close up shop, right? Whether it's for schools, cities, or counties. So generally speaking, everybody had seen, or more than half of respondents saw that service demand increased faster than in the recession in the first wave, so 6 months after COVID. And in the second wave, that was still the highest proportion of responses, though service demand had abated slightly. That said, we thought this was relatively marked, and so we asked specifically what kind of services were driving this. And we looked at two different we asked about two different service categories. One was in relation to health, and the other was in relation to public safety, right? Both in terms of COVID specifically, but also about the Black Lives Matter protests and et cetera that was going on throughout the same time period, right? So if you look at the top pie charts on health, we saw that overall, health services, increase for health services increased faster and faster than the Great Recession. This was not a surprise, but again, it confirmed that what people are telling us is kind of what is on the ground. We had initially asked only about emergency services, ambulance and similar, and the response for that is reflected in the left-hand side pie chart for health. When we broadened that to health in wave 2, many more people said that, hey, overall health demands are higher, even though emergency health demands aren't that much higher. When we asked about public safety, we actually weren't sure what to expect, but generally speaking, respondents saw service demands increasing and sustained across the whole time period and in SCAG as well. And again, about half say same or faster as the recession. So we thought this was interesting in terms of a baseline for service demand and revenue declines. So how does that impact the budget itself, right? Now that we've seen how people are feeling about their services and their revenues. So overall, we asked about financial position and how it has changed, and this is kind of your balancing your revenues and expenditure balance. And so here again, we have on the left-hand side, about 2/3 in the dark gray and the light gray said that their financial position was worse than pre-COVID, right? So if you think about that, that means we were impacted. It was either worse or a lot worse. By the time we get to April or May, so the past 2 months in 2021, this proportion goes from 2/3 to about 15%, right? The worse or a lot worse. And in fact, most have returned to stable or better, which we thought was relatively interesting. Now, this was a pretty general question, and next we asked more specifically about, within year budget balancing. But this is the overall, I think this slide conveys the overall picture well, right? Things were very bad and uncertain for local government finance, at least among cities and school districts in our sample. In fall of 2020. And then in the past 6 months, it has gone from not as bad to, maybe better. When we asked them specifically, could you tell us whether you're going to balance your budget in this coming fiscal year? If you look at the left-hand pie charts, in the fall, almost 40% said no or not sure. And this is despite a variety of, both financial and perhaps political pressures to do so. By the time we get to this time period, we are at 15% of people who think they won't or might not balance their budget, right? So things are much better. The split was pretty similar between school districts and cities in the fall. Currently, in the current wave, cities are doing slightly worse, whereas school districts feel much better. When we look at the non-SCAG versus SCAG picture, and again, this is for the most recent wave in this or in spring 2021, it's about the same, about 15-16% of non-SCAG and about 13-14% of SCAG said they would or would not. So that's relatively stable. And again, I wouldn't necessarily expect that SCAG would be particularly worse on this measure, but I thought for this audience that might be interesting. I also wanted to bring your attention to a few of the quotes we received. Again, these are anonymized, or these are anonymous, so I can't actually, or confidential. I can't actually say which municipalities or school districts said it, but I think it's telling. One of the respondents thoughtfully had said that, where are we going to balance the budget? Well, it depends on what you mean, right? If the definition of balancing budget is that the resources we have are greater than or equal to the requirements, and the answer is yes. But if you mean the resources we have today, this minute, versus current requirements, the answer is no. And I think that's a very nuanced position. And a little bit later on today, after our presentation, I think we're going to talk about a discussion of what balancing budget means, especially in these shifting times and shifting resources. Another one that I thought was, blunt and to the point. Municipal respondents said overall the fiscal impact was much less than we anticipated, right? Thought it was going to be bad, wasn't as bad. On the contrary, though, the school district respondent had said COVID added costs and reduced revenue, whereas the Great Recession only reduced revenue. I thought that was telling as well, because, as we heard from a variety of speakers today, things are going to look different, right? Design is different, needs for space are different, what people think and how they commute is different, right? All of that changes services and perhaps adds costs. So, we kind of wanted to conclude at least this part before I hand it over to Andre, with the fact that, you might look at those pie charts and say, well, by the time a year after COVID, only about 15% of entities think they're either won't or may not balance their budget. Well, that went down from the 40 you showed me. So should we care? And we actually think, yeah, you should care. It's notable. There's there's certainly pressure, even if it's not constitutional, on cities and on school districts and counties to balance their budget, or at least have some move around in their budget so that it appears balanced, right? Local governments have an institutional requirement to balance their budget. For some of them, it's in their charters. Failing to do so often affects your debt limit and your credit rating. So even if it's not in law, you're not going to be able to borrow at as good of rates. You're going to do everything you can to balance. And finally, these repercussions can lead entities to use, a variety of strategies to balance theirs, where it's interfund transfers, reserves, and other ways that they're going to at least signal the fiscal health to external actors, and if not, maybe actually have that fiscal health. And with this, I'm going to turn it over to Andre, who's going to talk to you about coping strategies, reserves, and transfers.
Thank you, Siva. And let me screen. Okay. Can everyone hear me and see? Okay. Yep. Okay. So yeah, the first half of the presentation really looked at how local agencies and governments were impacted by the pandemic. And so in the second half, we're looking at how they achieve this, let's call it success in balancing their budgets by the end of the fiscal year, right? And what we're going to show is that there's really a wide array of strategies that local governments use to get at this balanced budget. And here's the menu of options that we asked about, and you can see there's quite a few choices. We're going to highlight a few, but there's a couple of things I want to point out first before I go into the results. The first thing is that, as before, we're getting results from the October-December period and then the more recent spring period. These do not overlap, right? So the one for April-May is not cumulative of the entire year, but really speaks to this first half of 21, right? So whereas October-December only speaks to the latter half of 20. And so when people say, oh, we reduced services in 20 and then we reduced services in 21, right? These would be cumulative, but these, in this case, they're separate, right? All right, so with that being said, we want to highlight two families of strategies specifically, right? So the blue arrows point to strategies that deal with services, right? Reduction, restructuring, or elimination of services. And the red arrows deal specifically with personnel, right? So either laying off, furloughing staff, or reducing staff salaries. And so you can see that the most frequent strategy in both time periods by far was the reduction of services, closely followed by a different type of strategy that makes perhaps more sense, which is to defer any capital projects or maintenance expenditure, right? So this is just saying, well, we're not sure what's going to happen this year. Let's wait a little bit on those projects. Makes sense. But in terms of priorities, otherwise, the first strategy that governments tended to go to was either a reduction or restructuring of services, closely followed by elimination completely of services, but as a least preferred option in terms of services. The second most frequent option then went to personnel, right? And in both time periods, laying off was the top one. Right. One thing that is notable, though, in comparison between October and April, was that furloughing went down. Right, and that's, again, we can only speculate here, but one likely explanation is that furloughing staff for long periods of time became untenable, and governments increasingly turned to laying off staff directly rather than trying to furlough. And then reduction of staff salary was the least preferred and became less prevalent in the second period. The last thing I want to point out here is that despite this large number of options, other was one of the top choices in both periods, right? So despite this large number of choices, there was even more things that local governments elected to do to cut costs or increase revenues. And on that note, the last thing I want to say is that increasing revenue was a less preferred strategy overall, right? So you'll see at the bottom of each of those charts, things like increasing taxes or creating new fees and increasing fees were less frequent. There's some exceptions with, for example, new user fees being in the middle of the second period, and then raising money through debt or borrowing being a more frequent option. But that kind of gives you an idea of the main strategies governments use to balance their budgets overall. And comparing SCAG to the rest of California, very similar, right? The patterns are very much the same with one notable exception, right? Whereas the rest of California laid staff quite frequently, this is something that's mostly absent from SCAG governments, right? So you see that laying off staff is much lower in that ranking. And again, we can only speculate as to why that might be, and hopefully we can bring that up in discussion a little bit later. Right. So, governments use a lot of strategies, not all of them for fiscal reasons, right? And one of the strategies that we're most familiar with, because we probably all have had a taste of it, is to work from home. So we were interested in the extent to which local governments used the work from home option to either protect their staff or perhaps to reduce costs to some extent. And here again, some difference between California and SCAG specifically, with California about half of agencies saying that either none or up to a quarter of their staff was working from home more than 3 days a week, and the other half saying that at least 25% of their staff was working from home more than 3 days a week. In SCAG, in contrast, it was about 40% that did not use work from home much, and the rest between 25 and 75% of their staff using that option. And we have some contrasting data from other sources and other surveys that have been done in the past year. The first one at the top, you can see September 2020, it seems much higher, right? So first, this is the federal level, but it's also much earlier in the pandemic, right? When there was this kind of heavy-handed approach to stopping the spread of COVID. The results that date from April 2021, also at the federal level, parallel our results much more closely, right? With only 3% saying that they work from home every day, which is not quite the same metric, but matches our 5% pretty closely. And the last survey is from California, which state that at the state level, at least 75% of employees were estimated to be able to work from home. But that ultimately was up to agencies to do it. And so, we cannot use this same benchmark for local agencies, but most likely a lot of agencies elected to keep a fair amount of their staff in the offices a lot of more time than was necessarily an option. All right, so these are kind of cost-cutting strategies and revenue-raising strategies that were not really employed. Another type of strategy that was available is to use reserve funds and then transfers. And here we see, let's see, a couple of things, right? So in terms of reserves, we asked, first of all, whether agencies had a reserve fund for times of crisis. And by and large, most agencies have some reserve policy. This is not the same as actual reserve, right? There's some variation in terms of actual reserve and how they map onto requirements, but we can assume that most agencies have some kind of reserve. How they use the reserves varies quite a bit more, right? So in the first period, about 40% said they had used their reserve already to plug holes in their budgets. And another 30% said that they might in the future use them, leaving only 33% that were confident that they were not planning to use those reserves. Fast forwarding to the last 6 months, and the picture changes quite a bit, right? Now, over half of respondents are saying that they will not need to use reserves to balance the budget, with only about 30% or still 30% saying that they're already use them, and still 20%, despite being close to the end of the fiscal year, saying that they might use them to balance their budgets. Comparing SCAG to the rest of the states, quite similar with SCAG using less reserves by and large, but otherwise quite similar to the rest of the states. So I won't dwell on that. Right, so the last kind of set of strategies I want to introduce is intergovernmental transfers, right? So that's kind of can be a major source of revenues for local governments. And so we asked them how they were impacted by the economic downturn. And some of them we were expecting, right? Like fuel taxes, the reduction in driving, there's a pretty clear relationship there. But otherwise, state transfers, the one that were perceived to be the most impacted by local agencies, with the other two, federal transfers and all other types of transfers being much less impacted in both time periods, right? And so we see some recovery in fuel taxes in the second period, but to kind of the overall distribution stays the same overall. And here again, for the state as a whole, we see a similar pattern, but SCAG is looking quite different. Two things to point out. So first is that the distribution of each of those transfer types is pretty evenly distributed. But as a caveat, right, SCAG is only a sample of 15 for this question, and so it's a fairly small sample that might skew things a bit. Right, so I'll leave it at that in terms of impact on transfers to transition to something that is perhaps more contemporary to what we're thinking about, and that's the change in the actual stimulus money that went to local governments. And here we see a very dramatic change from the first period to the second, right? And the big change being that with the Biden administration, right, there was a legislation of a stimulus package that had specific explicit provisions for local governments, right? So local governments, in this case, knew that some funds were going to be funneled to them. And we see that reflected very clearly in the data with the number of response saying, or the share of response as saying that they think the stimulus will help going from 15% in the first period all the way up to 70% in the second period, and much lower share thinking that it will either not help or not sure. And again, comparing SCAG to the rest of the states, the only difference is SCAG is even more confident that those stimulus packages, even before they had reached them, right? Because at the time of the survey, most of those funds had not been dispersed or reached the local governments. Even then, they were very confident that it would make a big difference. Right, so kind of digging deeper into that, we can look at some of the qualitative feedback we got from respondents. And here, two things come out, right? So in the first two quotes, it shows that there is some awareness on the part of local governments, right? They know that this is coming, they know that it will help, but they also know that there's a lot of paperwork involved, there's a lot of steps before those funds get to where they need to go, right? So yes, it will help, but it also has some burden attached to it and some cost attached to it, and that will probably delay the positive impact. The other type of issue that is foreseen is that all these things take time, right? And not only they take time, but then the impact might be short-lived, right? So the last quote we have here highlights this idea that sure, it might plug the holes for this year, but we don't really know how it's going to help next year, right? And we might have to do the cost-cutting strategies not this year anymore, but next year, surely there will be no longer those stimulus payments, and we'll be back to having to make those cuts. Right, so I'm going to just quickly sum up, right, some of the main points. So the first thing is that the level of uncertainty that was prevalent in the first 6 months has kind of been replaced with greater confidence and optimism about at least balancing budgets, but a lot of the strategies that we've seen in terms of getting there have persisted, right? So a lot of cuts are happening, and so one of the things that we're interested in hearing from you is about how is that going to affect the recovery stage of the coming months. Right, actually, I'll leave it at that because I want to leave as much time as possible for discussion. So I think I'll turn it over to Gigi, who will, I think, moderate the questions. And if we run out of questions, we also have some questions prepared for you that hopefully will generate some discussion. Thank you.
Yes, if anyone has any questions for Siva or Andre, go ahead and speak up or unmute yourself and ask your question. I also invite you to write your question down in the chat. And I mean, I actually have a question. A lot of the agencies that shut down, you said they reduced their services. I was wondering if there's any evidence, if you found any evidence that in their shutting down of services and restructuring services, if agencies found efficiencies, they discovered efficiencies that can be sustained. So say they eliminated services they can do without. Have you found any evidence of that, of any sustainable efficiencies?
It's a great question, Gigi, and hopefully one will hear more from the audience as well, given your agencies. Two things I was going to say. One is a lot of what we heard was temporary suspension of services that probably weren't being used anyway because of COVID. Library staff being furloughed because libraries were closed, parks because park services were closed for a while, et cetera, et cetera, et cetera. Kind of reduced services where there was less services needed. I think some of that will probably come back to the extent that they could sustain either the programs or the people. What has, I think in terms of cost savings or operational savings, it was, from what we heard, is less of a whole-scale change in operating model and more kind of efficiencies from going online. From paper, several people mentioned, no, now we do permitting online. Maybe they weren't doing that before. Now we do a variety of forms online that we weren't doing before. We do queries online. We're more using 311, open data, right? That's kind of things. People were either not thinking about them and are now thinking about them, or they had been thinking about them and were not pressed to do it, and now they had to do it. So those are kind of two of the common groups of things that I think speak to your question.
We have a question. Thank you. We have a question in the chat. So Irina asks, inequality continued to widen during the pandemic. Are the pressures showing up in your survey results? Any particular patterns, how they're responding, or was the stimulus targeted enough to get those who were hit the hardest?
It's a great question, Andre. I'll take a little bit, but if you have more. So I was going to say, I think the clearest evidence I've seen from our survey respondents was that small entities, small school districts, small municipalities, ones further from urban areas especially, were the ones who, they basically responded as, we were already not in great shape in some cases, and this just made it worse. Right? That's true for administrative burden of the grants and of the, complying with health regulations and distancing. And that's true with general kind of ups and downs. So I also, another form of inequality where, even though they didn't respond like that, I think it applies, is several school districts especially said, hey, we mostly operate on property tax revenue. When that goes down, the state backfills it. But what we saw, as Andre showed, is that state transfers were down for about half of respondents. And we know that property, even though when property taxes maybe were up, but perhaps because of unemployment, people weren't paying them, or there was deferrals. So they were probably stuck in some limbo, and that likely affected places which had lower property tax revenue as a result, because there were fewer state transfers. So I think that's that. Andre, do you want to take the next question on ARPA money?
Yeah, just to add to the previous one as well, I think getting at inequality is a bit difficult, but really what we've seen is diversity of types of municipalities and local governments that are in California, right? And so things like resort towns stand out as having a very different set of circumstances they're dealing with than, say, highly urban central cities in the Bay Area, right? And so kind of the full range of local governments came out, and it was very clear that they were answering in different ways and facing different pressures. So I think that's kind of digging deeper into the data, we'll probably see some of those varied circumstances come to the fore.
So the question in the chat, so Stephanie asks, is there any evidence that the improved outlook has to do with the influx of ARPA money, or has there been brought into the scenario yet?
Yeah, I can take it, I guess, Andre, if that's easier. So we asked in the first wave in the fall, we definitely heard about CARES Act money. Now, a lot of that didn't go specifically to agencies, but it seemed like it went to people who lived in their jurisdictions. And so maybe that was tiding people over. So that was specifically noted in a variety of text responses. In terms of our, ARPA money in the current, or in the last wave of spring 2021, we explicitly asked about whether they're expecting it, whether they thought it was enough for them, how they were planning to use it, whether they had received it, the full suite of questions. And the discussion was robust. Many people were excited about it and was like, we have a plan, or we're forming a plan to use it. There was a certain group of respondents, kind of like the ones we showed in the quotes, that had said, we know it's coming. We don't know what to do with it. We think it's going to be a lot of requirements, and it's going to be a short-term dump of cash, and then it's going to go away. Though others said, hey, we're going to structure it over years. So it has been brought. I think it's flowing as we speak. I don't know if you have anything to add.
Yeah, I mean, I think that it contributed to the more positive outlook. There's no doubt about that. But I think there's a more robust foundation that this shift is built on, right? And so one of the questions we did not show, but we have in our survey, is kind of expectations about what sources of revenue will come back soonest, right? And so there's, I think, confidence that things like property taxes, but also occupancy taxes, as tourism recovers, and sales taxes will come back pretty swiftly. And I think that's this optimism and kind of a rapid bounce back of the economy overall is what's driving this optimism.
Thank you. Thank you for those responses. So are there any other questions, or maybe we can ask our audience some questions as well. So what has been the experience of the agencies, of individuals who are here, your individual agencies, and with respect to the impacts of COVID? I'd be interested in hearing what the stories out there are.
Margaret?
Go ahead.
You know, it was interesting today. I went down to City Hall to go to the fitness center to work out. And they said I had to wear a mask. And I said, wait a minute, it's the 15th. I don't have to wear a mask. And they said, well, we really haven't come up with what the protocols are quite yet for our city. And I think, honestly, with this, it's kind of like everybody was waiting till the 15th, and now what's going to happen? Well, I also went to 2 banks today. One of them required a mask. One of them said if you had been fully vaccinated, then you didn't have to wear a mask. Well, then someone said, well, how do you know that this person has been fully vaccinated? So there are really still so many questions that we're running into. And then I called our city manager and I said, okay, what's going on? And he said, well, there's still people that are concerned about coming back to work. So to me, right now, we've been kind of in this period for the last 15 months of we don't really know what to do, but everybody thought on the 15th, it was all going to go away. And of course, clearly it hasn't. So kind of a question that I have for all of you has to do with, did you anticipate something different for local governments? Because I think there are a lot of people that did, that they felt that the 15th was going to come and go and there were going to be no problems anymore. But how are you telling governments to operate now, or are we kind of being quiet right now as we wait for all of this to happen?
Great question.
I think it's a great question, and maybe anyone in the audience want to respond or at least share their perspective, because I think that was a very poignant question. If no one wants to volunteer, I think kind of from our surveying perspective and what we've been hearing from in terms of both the opening and how the fiscal situation has gone and how operations have gone throughout the year, I think we didn't expect as quick of a recovery in both budgets and strategies as we kind of saw from our numbers in the spring, right? We thought people would still be mired in dealing with health reopening, and that would be affecting them more. But our data kind of shows slightly otherwise. I think we see something in chat as well.
Right. So Stephanie writes, the problem for many is that Newsom declared today as the opening, but those who are regulated by the DHHS are, for example, have not received updated guidelines. Actually, that brings a question up for me. So in your latest wave of surveys, have you observed any return to that uncertainty that you observed last fall? So like going back into some level of uncertainty because local agencies don't know how to respond, or as Stephanie points out, they haven't received guidance.
Yeah, I think that's one way to put it is that uncertainty went from being about what is happening at the moment to being about what's going to happen in the future, right? So whereas people were really uncertain about what was happening in the first months of the pandemic and how to deal with it at the moment, now I think we see a lot more uncertainty about what is going to happen during those kind of reopening phases. And we're already seeing that obviously as kind of those guidelines are causing confusion about where everyone is standing.
Mm-hmm. Right.
We
Diana?
want to hear from Diana.
I'm sorry, Siva. Okay, there you go. Mhm.
Oh, there I am. I just wanted to respond that in terms of your question regarding fiscal impact on cities, it varies so much for cities. I'm the mayor of the city of South Pasadena. We're a small city of 26,000, and we have virtually no tourism associated revenues. And we would have been hit more substantially because we it's now a service economy. I'm earnestly waiting for the legislature to wake up that we're no longer a goods-oriented economy and that we change sales tax to apply at least to a modest degree on services. But until that happens, we have a fair number of restaurants, and obviously our sales tax revenues really significantly declined, except that we had, as a number of cities in Los Angeles County did, had recently increased our sales tax to the state maximum ceiling. And there was a 75-cent headroom that is solely available to us. Unlike other sales taxes, it's not shared with the state or in any other formula, and that saved our bacon. And so we took there is I believe, a decline, but not nearly to the extent that it would have been had our voters not recently voted to support that 75-cent sales tax. And I know a number of cities in the county have done that. And so I hope they experience the same thing. Having said that, I know, for example, City of Santa Monica and West Hollywood, which derive a substantial portion of their general fund from TOT occupancy taxes, they were really hurt very significantly. A lot of layoffs in Santa Monica, I know. And I happen to know the City of Hawaiian Gardens that derive an incredible amount of their general fund from gaming club revenues, really suffered a steep decline, and they laid off their city clerk. And my city clerk is a former employee of the City of Hawaiian Gardens, and their loss is my city's gain.
Thank you for sharing that. I'm curious, Diana, if you were to go back, so given what you've learned over the past year, what would you do differently? To be more resilient to a pandemic or a crisis like this?
That is a really tough question. We responded fairly quickly in laying off our community services staff. We did not lay off any library services staff because our library is literally the heart and soul of our community. And so we still had robust demand in our libraries. I think the way we responded was adequate for what we knew at the time. And it's difficult to go back and say what we would have done, just because the information that that was available at the time was so limited. And now obviously the science has evolved to the point that it's not necessary to wipe down everything. So we might have tried to perhaps keep our senior center open. We were very fortunate. We had a robust participation from community volunteers who delivered meals to our seniors. And had we been more aware of the fact that, well, no, maybe there is a way to house them with appropriate distancing and all that, we might have tried to do a better job of continuing services to our seniors. But the earth was constantly moving under our feet.
Right, right. Thank you. And I should say, I love the South Pasadena Farmers Market. That was one of my favorite activities when I lived out in that area.
And that was tough. We took a hit when the county took so long to allow the prepared food vendors to return. So it was a great learning experience. And I think that your question is really more appropriately directed at public health personnel, because they're the ones who really had the most to learn, I think.
Mhm. Right. Thank you for sharing that.
Thank you, Dan. I was going to say might be an appropriate time to ask of the audience as well. Andre, if you want to go to the looking to the future page. One of the things, and this is to Gigi's question earlier as well, right? And like as Diana shared, cities do such a variety of things, and as a result, they have a variety of strategies available, and kind of our data capture those. How likely do we think are any of these changes to persist, whether it's kind of the efficiency changes that I was talking about, or kind of the more broad scale, what does a city do changes that maybe we can learn collectively from COVID, and are there potential costs to such, both financial but also kind of societal costs to such changes? I don't know if anybody on the call has been thinking about this or wants to think about this, but we'd love to hear from you.
Can I ask a different question, which is, this is Irina.
Yeah, go ahead. Go ahead.
Which is, we've heard a lot over the last parts of the conference about different demographic changes, and millennials are changing and people are changing where they live. And I'm just really curious to see whether locals have internalized some of these shifts that we probably are going to see as people recover. And, I get this overwhelming sense that everyone's like, okay, this wasn't as bad as we thought. Now we can go back to business as usual. And I just don't think that we are going to go necessarily back. So has anyone in their responses said how they are going to adjust to this?
So I think generally speaking, no, I don't think they're seeing, especially, we heard from a variety of suburban and exurban jurisdictions and school districts. They're not saying, oh, wow, enrollments are now going to go up, or, hey, we're seeing this bounty of, real estate transfer taxes, which are a thing at certain places. Now, those weren't particularly impacted either. And perhaps because the housing costs have gone up, or housing prices have gone up so much, right? They're seeing receipts from those. But no, we didn't hear so much about how they're going to have to change service levels or even service types based on migration, what kind of within region or across regions.
Interesting.
Thank
Thank
you. From the city of South Pasadena, we're in the process of updating our general plan And we had intended to do a lot of mixed use development, but now I think there's a real question as to the amount of retail that is sustainable in a small city such as ours. And so perhaps we need to look at what would have been designated as retail space, something else like a workspace for the residents in the building, or other office space, or some other use other than retail, because I just don't know how much retail is going to be sustainable given what I think are permanent changes in shopping habits that I think to a large degree are likely to persist post-pandemic. It's just too convenient.
Are there barriers that have brought up that prevent them from restructuring that you guys saw in your survey, or perhaps that our audience has experienced or has observed? Any key barriers to allowing localities to adapt and to change and restructure?
We didn't see so much on barriers to restructuring. I think certainly, again, the places that were strapped responded as if they were, all hands on deck, and we're doing everything we can. And, regulations are changing from Department of Health or Department of Education, and we're just doing what we can. And then others, we're kind of perhaps relying on reserves or a mix of reserves or transfers or line item moves to kind of keep going as usual. So it didn't seem like it, but there are several people who said that they were looking to contract out more, though that wasn't a general, we asked about it wasn't a general trend, but definitely certain people said, yeah, I'm going to contract out more. I don't want to deal with this particular service anymore.
Thank you.
Just adding a little bit to that, I think that's one thing that's kind of reiterating what Sierra just said is a lot of those garments were already kind of stretched in terms of capacity. And so that's kind of a structural constraint that was there already, and that's only made it worse. But I think one of the things that really the survey reminds us is that most local governments in California are very small, right? It's interesting to hear, San Pasadena discovered as a small town, which within the region, it is a small town, but within California, right, there's a lot of local governments that deal with towns of 1,000 or less. And those kind of already work on shoestring budgets. They often kind of collect their resources across district, right? We have some response that work for several districts, things like that. And so I think that's in those cases, it's more a game of catch up and thinking about what you've done better, because they already were stretched as it was. So I think that again, kind of repeating something I said earlier, the diversity of local governments in the states really comes through, and I think that there's no easy generalization there.
That actually brings a question to mind, is that I'm wondering if there are particular services or activities that local governments that are small, that local governments would appreciate or prefer that are done at a more of a regional level. That maybe the pandemic brought up that, well, maybe we shouldn't be doing this ourselves. Maybe that needs to be done at a more regional level. Like, I can't think of a specific example, but I'm just wondering if there's any services or roles that cities play that really they're too small to really do in a cost-effective way, that perhaps a regional organization can coordinate those activities or services.
Yeah, we definitely heard some of that. And I mean, California has the kind of contract city structure, which is a type of city you can be where you provide certain services, but then you contract from, higher level of government, such as the county or further up. So we definitely heard from some contract cities that they either were relying more on the people who were providing the services, now whether that's police, fire, or otherwise. And in terms of receiving grants, or I guess transfers that were COVID related, oftentimes it was actually for the city, for the local contract city, even though the services that are being provided under that might be from whoever they're contracting out. So they are a little bit the go-between, and several times, and not anecdotally, but in qualitative responses, they said, hey, we're actually not staffed to even, handle grant submissions and regulations of this type, because that, either they had outsourced that, or it's just they're keeping a much leaner situation. So that wasn't necessarily expected. And we did hear from, other agencies like the Regional Government Services Agency, which provides, regional services, planning and development, variety of types in California. So I think they are thinking of these strategies in various joint powers authorities, but it's not a full-scale shift, which we thought there might be.
Mhm. Okay. Thank you, Siv. So our time is up, and so I want to thank Andre and Seva for their presentations, and I want to thank everyone for joining this roundtable, and thank you guys for all your questions. Thank you, and on the chat, the link to the project is there. So if you guys would like to learn more about it, check out the link in the chat. And have a great day, evening, everyone.
Thank you all, especially
Thank
to
you.
those participated in the discussion. Thank you.
Thank you.